Men often walk alone. Who do they turn to for answers? Being male is a matter of birth, but being a man is a matter of choice. This is the dawn of something phenomenal. Fathers, sons, brothers, from the daily grind to the battles within. This is where real stories are told. A place where the silent struggles are given a voice, where the unspoken truths are laid bare. No holds barred. Brace yourself. This is Men on Record. It's more than just talk. It's a man thing.
Good evening and welcome. The 15th day of May 2026, a beautiful, beautiful Friday evening that yet again we get to congregate right here as men as we discuss everything and anything that is touching on men. And yes, if you're joining us for the very first time, this is Men on Record, and we are live across Hope Media. We are live on Hope FM, the station you listen and live, Hope TV, where you look and live, and also you are getting us across all our social media platforms. It is mid-month, and we are thankful to God's grace and mercies that are new every day, every morning, and it is another day, another evening that we come to discuss anything that touches on us as men. And so every man who is in the house, ahoo! Good evening and welcome, young, middle-aged, and even the old. This is your space, a safe space, as we discuss everything that is touching on you. And tonight, it's a special one. Tonight, it is a simple one, yet very profound. We'll be telling you much about it as we continue. But remember, if you're joining us for the very first time, Men on Record is an engaging TV and radio show that is created for men and also about men. And we are here to unpack real-life conversations that shape manhood in today's fast-changing world. And so we are here to create a safe space, honest space, where we as men can be able to speak, reflect, and also grow without shame and without pretending. And tonight's conversation is quite simple, relevant, and deeply personal. Men and health. And this is why, because many men are struggling silently. Some are battling all sorts of things: stress, burnout, lifestyle diseases, depression, anxiety, fatigue, poor eating habits, sleeplessness, and even emotional pressure. Yet, many still keep saying, "I'm okay, I'm fine." While taking care of everyone else, many men have neglected themselves. They postpone hospital visits. They ignore warning signs. They suppress emotions and push through exhaustion and even suffer quietly. And to help us unpack this important conversation, this evening we are joined by a man. He is a surgeon, he is a neurologist as well, and also he is a friend of Hope. And this is none other than Dr. S.N. Waweru, and he will be helping us unpack tonight's conversation. And so be part of the conversation. Tell a man to tell a man. Invite your husband. Tell them that it is time for them now to have the remote, to have the radio on as well. Invite your son as well. Invite your nephew, your uncle, any man who is in your life. Please make sure you are inviting them to tune in to tonight's episode. Be part of it as well. Hope TV Kenya across all our social media platforms. Hope FM Live, that's also on our social media platforms, the radio side. And also you can get us on WhatsApp. Any question that is related to men and their health, this is the time for them. And you can be part of it as well on the WhatsApp platform 0708 222 323 or on 0717 400 555. And so right about now, my name is George Gishoro. Allow me to welcome our guest, Dr. Waweru. Good evening, sir.
Good evening, Gigi.
And good to see you.
Thank you.
You're well?
I'm glad to be here.
Karibu sana. It is such a joy. It is such a huge pleasure to have you join us on this very important set where we discuss everything that touches on men. And I was being told, you know, for ladies, they have the gynecologists. And so someone was telling me that you are the gyna for men. I don't know how true that is. You will be demystifying that for us. But anyway, thank you so much, Dr. Waweru. It is such an honor to have you join us. And I don't know, a brief introduction of yourself, even as we begin our conversation.
Thank you, Gigi, and thank God that I'm here.
Karibu.
My name is Dr. Samuel Waweru.
Yes.
I am a believer,
Yes.
and a follower of Christ, and I work as a urologist, that is a surgeon who takes care of the urinary system
Yes.
and the electrical system thereabout.
Yes.
So we are basically men, and we also take care of the reproductive aspect of men.
Mm-hmm.
And we are called, urologists are called men gynecologists.
Yes.
I also called plumbers. Because we just deal with pipes. And,
Yes. Yeah.
So that's what I do.
Yes.
I've been a doctor for a while, about 35 years by God's grace.
Yeah.
And I believe, God willing, I have something to share.
Definitely, you have something to share, I believe.
Yes.
And that's why we are here, so that we can also be able to get to tap into that knowledge that you have in as far as men and their health is concerned. And to start us off, let's lay this foundation. And some ladies, when they saw the poster for our conversation this evening, and they saw me as we were, preparing for the show, they were quite, excited, and they came rushing, and they were like, make sure you ask Daktari, one, why men don't like going to hospital, and number two, why every time they have even the slightest flu, it's like the world is coming to an end.
Yeah.
Was that a fair judgment?
I think it is. Men are slow to act on medical issues.
Yes.
That's a fact.
Yeah.
But I think it starts when we are young people,
All right.
young boys,
Mm-hmm.
as opposed to the female
Oh, yeah.
ladies. They get to puberty,
Mm-hmm.
and they see breasts coming up,
Yes.
and they start having menstruation.
Mm-hmm.
But nothing much changes for the young boy apart
Yeah.
from a change in his voice.
The voice, yes.
And the other changes are hidden.
Yeah.
And therefore the female, the lady, who know that the things keep changing, things are dynamic, and
Yeah,
therefore
yeah.
is interested with these new developments. And that is where they start having an interest in checkups
Yeah.
and an interest in what is happening to their body.
Mm.
For the man, nothing changes. For instance, the prostate will change at puberty,
Yeah.
but nobody realizes that. And I think that is what makes men really a bit not quite concerned about their health,
Yeah.
because nothing has changed. You're still a man, you're becoming stronger, you
Yeah.
can see the muscles,
Yeah.
and therefore you feel you are okay.
Yeah.
But I think we are also seeing this changing. I think for the last 20 years, we've seen a trend and a change where men are actually quite eager to find out about their health. So
yeah.
we've seen a change. We have, remember, about 20 years ago, or so, 24 years ago,
Yeah.
after I finished my master's and got some job at the Mater Hospital. And during our master's in surgery, every disease, especially the cancers, the African man presents late. And therefore, one of the things that I wanted to do that time was to come up with checkups for men. And so I wrote a proposal to the CEO of that hospital.
Yes.
And we started the first Wellman Clinic. Wellman Clinic in Nairobi.
Yeah.
And the idea was to screen men so that it's tailored towards getting the diseases that affect man regularly. And we were able to start that. And it still runs. And there are many more clinics that have come up.
Yeah.
So because of this wellness checkup, we are getting men going for checkup and diseases being caught very early
Yeah.
at a stage where they are amenable to medical treatment. Yes.
Yeah.
So I think there is a change.
Yes. At least there is a change now. Men are especially eager to get to know, about their health.
Yes.
Now, in your experience, now that the many years of experience in as far as treating men, what are some of the biggest, if you can say, health challenges that are affecting men, and especially today? And Daktari, I would want you to help us in breaking those challenges, major health challenges, into three, because there are those that affect, should I call them young men, the young men, then there are the middle-aged, and then the older men, and some of the things that we need to look out for in all these stages.
Okay, very interesting question, and I like the perspective you put them in. When you're looking at a man, for instance, a teenager, I mean, a man is from 18 years going up.
Yeah.
But, we must mention even our toddlers and the boy child.
All right.
I think we see a lot of obesity, childhood obesity, and that will have a bearing on how you grow up. So it all starts from
at that age, a toddler.
Yes, it also means if you take care of the young one, the kid, psychologically in a good way, then you're also building up a person who will be more psychologically stable and not traumatized. But anyway, from 18 years, or maybe from teenage, just to mention this, from puberty, we see most of the diseases, especially from a urological point of view. One of the diseases that I would like to mention is at that age, the boy child who's entering puberty, there is an increase in the body size of the genital organs, and they get the voice breaks, and they start getting pubic hair, growing pubic hair. But at that time, the testes grow in size. At that time, they may get what we call testicular torsion, where the testes twist.
Yeah.
And about that time, if you don't act, then they lose the testes within 6 hours.
Wow.
So, and that would affect.
It's a matter of hours.
It's a matter of hours. So for the prepubertal or pubertal boy who has testicular pain, it's not an infection.
No.
It is most likely torsion of the testes. And so it's because the blood supply is from above. The testes are usually develop just below the kidneys and come down to the scrotum.
Yeah.
For better temperature and for spermatogenesis to occur. The other one that you would see is for the young guys is really things like hernias, injuries related to sports or accidents, but basically they don't have a lot of problems at that age.
Yeah.
And then you get to young adults again. If you take care of your weight, then it's time to bring up a family. So you're most likely taking care of other people.
Yeah.
And you don't have a lot of challenges. You may get issues like with appendixes, ulcers, because of the stress that you get in terms of taking care of the family, taking care of your profession and career. And then we are seeing a few from the urological perspective. We are seeing some young men with low testosterone, which should not be the case in your 20s, 30s, to 40s.
Yeah.
And that is still perplexing because it shouldn't happen.
Yeah.
And then as you move on, you have, from a reproductive point of view, that's the time you will also see men seeking help from a reproductive point of view.
Yeah.
Maybe they've been married for a few years and have no children. Some of the factors that we see are things like varicocele and the rest. These are vessels that are engorged in the scrotum, just above the testes. You also see low sperm count and low testosterone that I've mentioned.
Yeah.
Then in the 40s, you start now getting to lifestyle diseases like hypertension, diabetes, cholesterol issues, weight issue, And then you also start getting things like erectile dysfunction from a urological point of view. And as you move on to the 40s and 50s, that you also start now getting some of these malignancies that come in.
Yeah.
You start getting cancers here and there. You start getting lifestyle diseases, basically with cardiovascular effect. You get issues with weight and the rest. And then as you grow older to your 60s, then you start getting the cancers become even more common. The diabetes has grown old. The hypertension has grown old and has started affecting the kidneys. You start getting joint issues and bone issues. And then you also start having prostate issue, be it enlargement of the prostate or prostate cancer. You get bladder tumors, you get colon cancers at that age. And also something that happens is you also start having a decline in testosterone. And therefore, sexual decline, and then decline in terms of cognitive function, and in terms of the cardiovascular, the gastrointestinal tract. So as you move on above 70, again, the prostate issues, the bone issues, the colon issues, heart issues are common. And then eventually you're also getting dementia coming in, which is also something that is common, especially in men in their 80s. So that in a nutshell, I hope I have mentioned a few
of them. There are certain that you have mentioned for young, let's even start from this teen, going all the way to the young men, middle-aged and the old, and the importance, because now here I want to bring the aspect of parenting, especially for the preteens, teens, and the effect that you have talked about in terms of they can lose it within hours. How do they ensure that the boy is safe?
Okay. Again, it also starts at birth. My daughter got a boy, my grandson, and when I visited them, I told my daughter, I want to see the urologist. Just basically make sure the testicles have descended, which is a common problem, and make sure the organs are okay. And then for the pre-pubertal is mainly a question of talking to them and telling them, and I do this when I meet young boys. If you have pain in the testes and you're in boarding school, tell the nurse it is not an infection. The doctor said it's not an infection. Tell them you think there could be some torsion or something happening. So you don't feel shy to tell your parents, don't feel shy to tell whoever is responsible that could take you to hospital.
Awesome. And we are here, we are talking about men and their health. Be part of this conversation, and this is at Hope FM Live across our social media platforms, Hope TV Kenya across all the social media platforms as well. We are also on TikTok. You can search Hope TV, Hope FM as well. You can use the WhatsApp number that you have on your screens, two of them, 0717 400 555. You can also get us on 0708 222 323, and we will appreciate all those questions. Any clarity, any query you could be having, you can seize this opportunity that we are having a surgeon, a urologist, Dr. Waweru, joining us on our set. We are taking a short break, and then we come back and pick up this very timely conversation. See you in a short while.
Rafiki soul is the promise of a hand that reaches and goes beyond what angaza tumaini kote. ukarimu, ukarimu. I'm forever grateful. Ninashukuru, ukarimu, ukarimu. Rafiki soul is a promise of a hand that reaches and goes beyond. Watangaza tumaini kote. I'm forever grateful. Ninashukuru, ukarimu, ukarimu. I'm forever grateful. Ninashukuru, ukarimu, ukarimu. Rafiki msoul.
Friends of Hope, keeping hope alive. As the first light of dawn breaks, a new beginning is born.
Join us every morning, Monday to Friday, for a refreshing time of devotion, inspiration, and insights.
Stay updated with what's making headlines and also journey with us as we have life-changing conversations from the financial fitness segment,
One day at a time,
the Christian walk,
relationship resonance,
and something special for you every Friday. That's the Beyond the Melody segment.
Join me, Beatrice Nudi,
And me, George Gishoro, for enriching, educative, and life-changing conversations that will kickstart your day.
Hope at Dawn, only on Hope TV, where you look and live.
Thank you so very much for your company this evening. This is Men on Record, and we are live, Hope FM, Hope TV, and across all our social media platforms. Thank you so much. We love the questions also that are coming in, the queries, the clarifications that you are seeking. Thank you. And you can keep them coming. We will try as much as possible to cover them as we continue with the show. And yes, we appreciate you so very much for that. Let's talk about and welcome back, Dr. Waweru.
Thank
Let's
you.
talk about the elephant in the room for so many men, erectile dysfunction. And one, if possible, because I know many are asking, what causes and is it reversible? How do you help one who is going through the same?
Okay, thank you, George.
Yeah, correct.
Erectile dysfunction, you're basically speaking about a man who is not able to sustain an erection sufficient for sexual contact.
Yeah,
And this has to, if it happens one day, it's not erectile dysfunction.
yeah.
It's got to happen persistently for 3 months.
Yeah.
And basically, there are various causes. Number one is psychogenic causes, stress, mental issues.
Yeah.
Basically, if you have a person with psychological ED, psychogenic ED, then you find that they will have the morning erection, but they will not be able to perform when it's supposed to perform.
Yeah.
But then there is also the non-psychogenic, which is organic. So meaning you have a disease,
Mm-hmm.
which can be caused by some of the diseases that are common, like high cholesterol, high blood pressure, and the medication for high blood pressure, diabetes, thyroid issues, kidney issues, kidney failure. All those cause erectile dysfunction.
Yeah.
Some patients also have erectile dysfunction because of the doctor has caused it. In terms of some of the growing surgeries that we do, the prostate surgeries that we do, the treatment that we give for prostate cancer and prostate enlargement. You also get some medications like the ones used for ulcers and all these things. They cause erectile dysfunction. Recreational drugs like alcohol, cannabis sativa, that is bang, the miraa that people chew, all those cause erectile dysfunction. Yes. You have issues with testosterone. If the testosterone is low, you get low libido, low sexual urge, as well as erectile dysfunction. Some of the cancer medications that are given also cause erectile dysfunction. There are also diseases that affect the reproductive organs, like having a bend of the male organ. Therefore, even if it is erect, it cannot penetrate. And also sometimes having ulcers and genital ulcers, and also having what we call a CODI and some inborn abnormalities of the male organ. In a nutshell, that would be the cause. And one of the things we are also seeing is obesity. And
which is also a contributor.
Yes, studies show that if you have a waist circumference above 42 inches, then you are most likely at risk of having erectile dysfunction.
That's 42 inch?
Yes.
Wow.
But the important thing about erectile dysfunction is that it could be a pointer of what will happen in the future. Because the basic problem is a vessel problem. So the artery to the penis. Because blood has to flow and be trapped in the penis for one to get an erection. So if that mechanism fails, if the blood vessel is narrow, for instance, because of high cholesterol or vascular diseases, then you find that blood will not flow into the penis, and therefore you will not get a good erection or no erection. That vessel is 2 millimeters in diameter. The next smaller vessel will be the one of the heart, the coronary, which is 4 millimeters. So by the time the 2 millimeter is blocked, then you may get the 4 millimeter being blocked, and that would be a heart attack. So we are interested with erectile dysfunction just to be able to get the man to the proper position in terms of erection, but also to avert things in the future. Yes.
So it is actually could be a pointer to something that is more serious, even in the future.
In the future, correct.
So that, talking to us, that means then we need to take care of our health, should I say that, because also the many things that you have mentioned in terms of medication that we are taking is also a contributor to the same, because that means then, doctor, that we are treating one
and causing a problem. Yes.
How do you know this? How do you address this whole situation?
I think the first one is to take care of the causes that are obvious, like high cholesterol. You can take care of that in terms of diet, taking less of animal products, less, and also avoiding things like cheese and bacons and the rest. You could also help in terms of obesity by watching the portions that you eat, and also exercise. And also one should avoid the recreational drugs, especially the young guys who think these drugs are potent in terms of giving you an erection. They don't. They actually suppress your erection. Alcohol is known to suppress the testosterone levels in the long run. Smoking affects the blood vessels, and lack of exercise, of course, gives you weak blood vessels.
And sadly, we have seen an increase in cases of the same erectile dysfunction, even amongst, should I call, young age group that you would expect to be functional and all, but there is an increase in such a
there is actually. Like just today, a few young men I saw, one 27 and another one
Today.
34, yeah,
27 and 34. Yeah.
have erectile dysfunction. And,
27-year-old and a 34-year-old.
yes, yes.
Yeah. Yeah.
And basically, we have to find out what is happening
Yeah.
and do some tests. But it is common in young people.
Yeah.
Yeah, actually, you see it more in younger people in our population as opposed to the older ones.
Yeah.
The statistics and the literature talks about 40 to 70 years, having 52% of men in that age bracket having erectile dysfunction.
Yeah. 52%.
Yeah.
Between 40 and 70.
Yes.
Yeah.
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 Yeah. So that's one in every two men. And that's high.
That's high.
That's high.
That's high. So we need to take care of our health, take care of what we are eating as well, the medication, and even some of the things we are consuming or even eating. We need to take care of that because it's something that is affecting not just you as a man, but also for those who are married,
Exactly.
affecting your marriage and also affecting your spouse. Another thing that also, Doctor, is prevalent and is affecting a majority of men out here is the prostate issue.
Or the prostate gland.
Yeah. Talk to us about that and how
Oh,
to
yes.
navigate.
The prostate keeps us busy
Yeah.
throughout the week, throughout the month, throughout the year.
Yeah.
You have diseases of the prostate, of course, is a reproductive organ.
Yeah.
It does produce fructose that helps a spermatozoa be able to swim. So you get prostatic fluid and seminal vesicle fluid
Yeah.
that help as part of the component of the ejaculate. And therefore, it's a reproductive organ, quite busy in the reproductive years, but also keeps the man busy after the reproductive years because it starts enlarging. And once it starts enlarging, it then would cause issues with blocking the urinary tract. The anatomy of the prostate is such that it houses the urethra where urine exits from the bladder. And therefore, when it enlarges, it will not be able to enlarge sideways. It enlarges towards the midline and upwards, and therefore makes the urethra, what we call the prostatic urethra, narrow and long. And therefore, the bladder needs to push with a lot of pressure to expel urine.
Yeah.
So eventually, if that fails, you end up with urine retention. But there are symptoms that you get for that, like a poor stream. When we were young, the young boy we talked about would throw his stream.
Yeah.
Some
the
say
farthest.
over a bull and the rest. Others say it could kill a cockroach.
Yeah.
But then you realize in your 20s and it goes down, and in your 40s it goes further down. By the time you're 50, it's just making sure your shoes are safe. And that's because of the prostate.
Yeah.
You also get frequency. You get some time you realize you're passing urine many times, but this can be because of also other factors like diabetes and medications that we use for heart failure and for high blood pressure.
Yeah.
You also find that sometimes you have urgency. So if I have urgency, then I cannot wait for this show to end. I have to go out and come back.
Yeah.
And sometimes you will get late and the urine comes out, and we call that urgent continence. Sometimes you may want to pass urine and you realize you have to wait for a while. We call that hesitancy. But eventually, if these are not addressed, you end up with retention, or you end up with kidney damage, because the volume of urine that remains in the bladder becomes chronic. Then that backload is transferred back to the kidney, and the kidney swell and start losing what we call the nephrons, the functional unit of the kidney.
Yeah.
On the other hand, you have prostate cancer, which may not have a lot of symptoms until it is late.
Yeah.
And the frequent symptom for prostate cancer is actually urinary frequency. And then sometimes erectile dysfunction. And of course, one wants to know whether there is a family history of prostate cancer, because we find that if you have a first-degree relative with prostate cancer, then your chances of having prostate cancer is increased by almost 7-fold. So, but for the prostate cancer, that has to be diagnosed through checkups. And this is why we want to emphasize on checkups.
Checkups, yeah.
So if you're a man over 40, you want to have a habit of doing a prostate-specific antigen test every year, okay? And as long as it falls within the normal range, then you're okay.
Yeah.
But if it is higher than the normal range is 0 to 4, if it is higher than that, then you need to see a urologist.
The normal is
0 to 4.
0 to 4.
0 to 4.
That's the normal.
Yes.
Yeah.
And so I advise men the best thing to do, and which I also do, is to do a PSA test during my birthday.
Ah, during your birthday.
A few days
you
to
must-
my birthday, I get a prick.
Yeah.
Yeah, and I think it is a good thing. You do that plus other tests that would be relevant to your stage in life. But the PSA is from 40 years. Other tests that can be done are there's some tests to check on the colon, to check on the pancreas, to check on your cholesterol, uric acid, and all these things. You can combine all those to be part of your regular medical checkup. If you got a rise in PSA, then you start looking for prostate cancer in some patients, especially if the physical examination of the prostate suggests that there could be something. If you have what we call a nodule in the prostate, then you start looking for prostate cancer. If you look for prostate cancer and get it before the PSA is 20 and above, then you can give that patient a complete cure in terms of, we have remedies, say the surgery or radiotherapy.
Yeah.
Yes.
Yeah. And now because we want as many men as possible to come for the test, maybe could it be that the cost implication is a factor when you want to come for the test and you are afraid of the cost implication? So maybe roughly how much does it cost?
It ranges, PSA test ranges from as low as 1,500
1,500
to 3,000 to 5,000 in the very expensive setting. And you're doing it once a year.
Once a year.
Yeah, you're not doing it every day.
Yeah.
And just to emphasize on checkups, I think men spend much more taking care of their gadgets than they take care of themselves. Taking care of your mobile phone, taking care of your motorbike, car, the bicycle, the car. Yeah, and you know when you're
good screen to watch football.
Exactly. And you know when you're working, the car is packed.
Yeah.
Then you realize that you're using more on the car than yourself.
Yeah.
So it's good to have that habit of having medical checkup. If there's anything I would like to pass to the men, and the take-home message is actually regular medical checkups.
Yeah.
You have to be intentional and have regular medical checkups. And it can be done in any hospital, in any clinic. Yeah. I think PSA tests, actually, if you look at the statistics of African countries, the uptake of PSA is just 4%, as opposed to what we see in the Western world.
Yeah.
And therefore, if you wait until you have bone pains or until you can't pass urine, then the PSA will be high. Once it's over 100, then you're having about a stage 4 disease clear. Yeah.
So it is important for us to go for those annual checkups. And it's good to take care of yourself before things get out of hand. Help us understand some of the unhealthy coping mechanisms that you have seen men deploy to cover up for their health deteriorating.
I think we mostly, you say you're okay and you feel okay. Obviously, yes. Sure, you're okay and you feel okay. But you are not going to hospital because you're sick. You want to know what is your state. What is the state of my prostate? What is the state of my colon? What is the state of my heart? How is my cholesterol, uric acid, etc. So I think one of the reasons we get commonly is lack of time. Of course, there is lack of awareness in the past, but now one has no reason.
No.
Okay, maybe too busy or you're taking care of other people, and some fear. I have colleagues who are doctors,
but they fear.
They say they can't go for PSA test. Can't go for
that which you don't know will not.
Yes.
And help us, because I'm thinking about, as we go along, and you mentioned it when we were growing up as young boys and all, we were also taught in as far as suppressing our emotions. And maybe this now has now gone to another level, a different level, whereby, because still emotions are very much involved in this. And because we are good at suppressing those emotions, so I'm now fighting whatever I am fighting alone and in silence. How dangerous is that? And especially to one's mental well-being.
Yeah. Okay. Yeah. I heard you guys had talking about mental health in the morning, which was good. I think when you're looking at a man's health, is the body, the mind, you know, it's both physical and mental health. So you cannot talk about other diseases without talking about mental health.
Yeah.
I am not an expert in that, that area. But I think the women are gifted in the sense that they are able to open up. Men take time to open up. And sema unajikaza kiume.
Wewe ni mwanaume.
But I think a problem shared is almost a problem halved, you know. Once you share, are confident about your problem, you realize that most of them are going through that, and or they have gone through that, and that would help in terms of not carrying too much stress, in terms of being able to express yourself and what you're going through. I think it's something that we all need to keep learning as men. Much as I'm saying they should share, but I'm also asking myself, how often do I share my problems with other men? You know, so it's something that we should be intentional about, to share, to speak out. It doesn't make you a weaker man or a lesser man. It makes you a much more responsible man, and it also makes us eventually come up with a more responsible society.
And there's a question here that is asking the frequency of using the washroom during the day and also maybe during the night.
I think during the day we call that frequency, and when you're doing it at night we call that nocturia. So you're kind of waking up many times.
I'm learning something.
To go and pass urine. During the day it's okay because it doesn't disturb you, just perhaps disturb what you're doing, and guys do it about 4 to 6 times in a day. And there are those who hold urine longer, which is not healthy. And it also depends on what you're taking. If you're taking caffeinated beverages like coffee, then or Coca-Cola and anything with caffeine, then you pass urine much more frequently. And there are people who have a habit of taking water. It's a good habit, because I think some people also overdo it. You're taking 3 liters a day. You spend quite a number of hours in the washroom. At night, basically a man should wake up maybe once or twice, especially those above 50. Anything more than that, then it's significant, because you wake up tired. And then it's not a symptom for the man alone. For those who are married, then also you disturb your partner. So it's a serious problem. And those who have issues, and we advise them not to take a lot of fluids after 5 p.m. So that they can be able to sleep and wake up fresh.
Now that we are talking about someone is talking about vasectomy, and how prevalent and what it is even for our own conversation here.
Vasectomy is a male sterilization. That means you have the desired family size, and therefore you want to excuse your spouse from using the contraceptions, which have their own pros and cons. You also have discussed with your spouse, and you feel you have the desired number of desired family, and therefore it is easier to do surgical sterilization in a man than in a lady. So what we do is that we would go to the scrotum and make a sub-centimeter incision and get the vas and transect it and ligate it. It takes about half an hour or so, and it's done. So it's something that is interesting. when I was training in South Africa, we would do that on a Monday morning. We would have about 10 patients.
Ah.
And when I came back, I would get one patient per year to have a vasectomy. And
Yeah.
I mean, even when they came, I would ask them, "Are you sure?"
Yeah. Yes.
And but now it's quite common.
It is?
It is common.
It is.
I almost do
Yeah.
maybe about 3-4 per month. It's quite common.
Yeah.
And men have become reasonable in terms of really taking the lead in terms of contraception.
Yeah.
And is affordable. It can be done in the simplest of hospital,
Yeah.
and it works. And sometimes the problem is when you want to reverse that. The
Oh, yeah.
success rate is about 40% or less. And if you've had the vasectomy for more than 8 years, it even becomes harder.
Yeah.
So you would have to use assisted reproduction to get a kid if you so desired.
Yeah.
Yeah. So it's something that's common. It's something that
So
has
at
been
least
done.
now it is being embraced.
Yes.
Yeah, yeah. Help us understand some of the misconceptions that you have had, especially as a medic, in terms of men and their health. Some of the misconceptions out there. Yeah.
Yeah, I think it depends on the age and where you are.
Yeah.
And I deal more with older men, not older men.
Older men. Yeah.
And I get all sorts of questions, especially about the prostate.
Oh, yeah.
And it's all rotating about having sex or not having it. Some have also been convinced that it is a number of partners.
That's a misconception.
Which is a misconception.
Yeah.
And some think it is either too much sexual intercourse or none of.
Yeah.
But that, in a nutshell, the prostate, in terms of having prostate disease or not having it,
Yeah.
has nothing to do with the frequency of sexual intercourse, the partners, the rest. It is all a misconception.
Yeah.
And I think the men should get this right. It is a disease. It can happen. It does happen in those who have chosen to remain single because of especially religious reasons.
Yeah.
I work in a Catholic hospital a lot. I see that. And also in the polygamous people, they all get prostate issues. Yeah. So nobody is spared.
No.
And so the misconception of relating it to sexual activity is wrong. The other one is some men believe once the urine blocks, then you're done. Your
Yeah.
time has come.
Yeah.
It's not true.
Start putting your house in order.
Yes,
Yeah.
it's not true.
Yeah.
Yes. In fact, it's sad. We had one man who
Yeah.
was a father to a friend, and he was told he has prostate issues. He thought this is what they call Mondiori. My time has come to an end, and sadly he committed suicide. Which was quite sad.
Yeah.
Sad.
Yeah.
The other one is in terms of the medications that people take, and we are seeing these a lot in terms of to counter erectile dysfunction. You find people self-medicating. A lot of medicines being sold in the internet. Some of them really don't work.
Yeah.
And if one has to use any medication to counter erectile dysfunction, it has to be a prescription medicine.
Yeah.
Because these are dangerous medications. So you don't self-medicate.
Yeah.
You don't decide the dose. You let the doctor decide the dose for you.
Yeah.
They do work and they are safe only when
Prescribed.
prescribed.
Yeah.
Yeah.
And that is important because especially for them who are going through the dysfunction, they feel that, and they have heard, men, we belong to groups and all. And so you had a friend who was like, I use this. And so you are like, let me go and pick them over the counter. And yet they don't know the side effects, of those medications. Someone is saying you can't finish the show without mentioning 1 Minute Man, doctor. So I don't know.
Who is that?
I don't know what they won't mention.
Okay.
But maybe, yeah.
Okay.
Maybe.
I think perhaps if I'm right, you're referring to premature ejaculation.
Yeah.
Which is means you get to orgasm before the time.
Yeah.
Which is as one professor used to joke and tell us, this is a disease that is 100% prevalent.
Yeah.
Every man gets it at some point.
At some point.
And therefore, I think it does happen. It is common.
Yeah.
It causes concern to the couple.
Yeah.
And very simple to really treat.
Simple to treat.
Very simple to treat.
Yeah, help us.
Well, the medication used actually was by accident.
By accident.
Yes, because you found that when people had mental issues and they were put on some medications to help them, antidepressants, etc.
Yeah.
One of their complaints was they had protracted orgasm. And therefore, the urologist thought perhaps we could use this medication, but a smaller dose. Yeah. So some of those medicines for depression, a smaller dose for a shorter period, they do work very well.
Yeah. Yeah. But again, they have to see a urologist.
They have to see a urologist or a sexologist.
Yeah. Because again, you don't want to self-medicate.
Correct.
And you worsen, the situation as well.
Yes.
Mental health. I'm coming back to mental health,
yes.
Because it's as a result of so many, pile-ups.
Yes.
How do we as men navigate the pressures that we go through at home, at our workplaces, and socially, so that again we are mentally stable to be able to navigate this life?
Yeah. Okay. Let me see whether I can mentally that. I think you look at the wheel of life.
Yeah.
And you have your career. You have your family.
Yes.
You have your finances. You have your emotions. You have your health, physical health, but also mental health and emotion. Okay, and then you have your spirituality. Because I believe spiritual health, spiritual well-being is very important. Especially tackling all these issues. So if you have an imbalance of all those things, you're doing very well career-wise, and at home you're doing poorly at family level, or you're doing very well financially, and your emotions are doing poorly. That wheel is not going to flow very well. So I think number one is a balance. And contentment. You cannot be like everybody. You just have to be yourself. And appreciate the small gains that you make every day in all those aspects: your career, your family, your little finances, your health, spirituality, which is important. So I think sometimes when you miss that balance and you overpush, you're pushing your career too much at the expense of other things, or pushing the chase of money, then you end up with some conflict within you. And then you end up with stress, and eventually you get mental health, which may be depression or other things. So I think it's good to achieve, but reasonably. So you don't push yourself too much. You just achieve what is reasonable. Because at the end of the day, I think is the balance of life. It's not excesses. So you don't push yourself too much academically, that you're doing too much and until you lose in the other aspect. And then you also take care of your emotions very well, and also take care of the toxins that are coming to disturb your cognitive function. The drugs that people take, and excess alcohol, etc. So physical activity helps. It has been shown that if you exercise, you produce things called endorphins, which elate you, and you feel happy, and you feel grateful to really tackle the day.
We have 2 minutes. We have some questions here. Hello, Dr. and Gigi. What is the cause of premature ejaculations? Is it treatable? How is the level of testosterone tested, measured? Is there a remedy for how testosterone? Is there a remedy for low testosterone? Is there a problem with high as well? That's one. Daktari helped me know. My hubby had hernia. My dad too. For my husband, it's since 2017, not been treated to date. My dad's is a few months. What's the cause and where can we find help now? And is it sure? Can it help? The hernia is on the testis.
Okay.
Yeah.
So premature ejaculation, of course, the cause is not known, but it's a complex neurohormonal balance.
Yeah.
So we don't go into the details.
Yeah.
But it's, as you said, it's easily treatable and it's transient. It's
okay.
not permanent.
Okay.
Yeah. The other one was on the testosterone level. The testosterone is a blood test. If you want to know your testosterone level, you do a blood test.
Okay.
And it's advisable to do the blood test between 9 and 10 a.m. Okay.
Yeah.
And it will either be normal, low, or some people have high testosterone.
Yeah.
The high has no problem.
Okay.
The low, then the low testosterone, if you are a younger guy, then you are talking about hypogonadism. The gonads are not functioning very well. Some of the causes of that will be like excessive alcohol intake, lack of physical activity, liver diseases, and some medications that we do give for prostate in the older man. It's treatable.
Yeah.
Okay. So we advise patients, if you're taking alcohol, please stop alcohol. Start exercising.
Yeah.
If you're taking some of the medications that could cause low testosterone, then tell you to stop.
Yeah.
And then if one needs that help in terms of replacement, then we do, especially those who are off the reproductive age group, we do use what is called a testosterone gel or an injection of testosterone.
Yeah.
You don't take orally because most of it will be broken down by the liver. But in the reproductive age group, for instance, a man who is still hoping to get children, if you give testosterone, the other function of the testis, which is producing spermatozoa, goes down. So your sperm count goes down.
Yeah.
So you don't want to do that. So you have to be cautious in the reproductive
balance.
age group. But also we know that as we grow older, about 40, the testosterone level declines almost by a percentage every year, or a unit.
Yeah.
So by the time we are older, it is down, and there's a lot of debate and talk about testosterone replacement therapy.
Yeah.
When we treat patients for prostate cancer, one of the things we do is to lower the testosterone. We call it either surgical castration or medical castration, because the prostate depends on testosterone.
Yeah.
And the prostate diseases also rely on testosterone. So when you have an older man, then you have to balance introducing testosterone therapy, which will help his cognitive function, which will help his cardiovascular function, which will help him maintain his muscular the muscle mass, which will help the bones be strong, which will help his GIT and etc., and also his sexual function. So you have to be sure you want to replace this, but also be sure you're not activating any indolent prostate cancer cells in the prostate.
Quickly, the one on hernia.
Hernia. So hernia, most likely the one they're talking about is what we call inguinal hernia or groin hernia. You have two types. So there's one that just swells at the groin, and there's which is a direct type, or one that goes to the testis. So what happens is that the root, the testis, descended through to the scrotum. When the boy was young or after birth, that root becomes a bit weak. So anything that causes strain in the abdomen, like a cough, constipation, inability to pass urine, or straining during passing urine, or if you're doing physical activity like carrying heavy loads and doing a lot of squats, then you can get a hernia. And they're called inguinal hernias.
All right.
So it's the intestines that actually protrude. Okay. So you have to do an inguinal mesh repair. So you either doing that laparoscopically or directly by having an incision in the groin.
Yeah.
And then you put a material which you call mesh, and then tissue grow over that and cover that hole.
Yeah.
Yeah.
So there's help. They see
there
a
is
specialist
help,
and they
there is
will
help.
be assisted.
It's one of the operations that when we are training as surgeons, that is one of the operations that we graduate into very fast.
Yeah.
And therefore, it can be done in any place. And the SHA does cover those
Yeah.
kind of things.
All right.
And therefore, one should get help.
Yeah.
Yes.
Time is far much spent, Dr. We need to call it an evening.
Oh, really?
Thank you so very much. But we can't allow you leave without giving us your parting shot.
Oh, parting shot.
Yeah.
Okay, thank you. Thank you for inviting me here.
It's a
Thank
pleasure,
God,
sir.
and it's been a
Yeah.
blessing to share the little that I know
It's a
with
pleasure.
the
Thank you.
audience.
Yeah.
And I think we say that man is born broken, and he heals by mending, and God's grace is a glue. So we are not perfect.
Yeah.
And nobody knows much more about medical
Yeah.
health or man's health. We are all trying, but I think there are basics that we can do right is watch what we eat. I think look at Exodus 16 when
Yeah.
God provided manna from heaven. Why was it a certain portion?
Yeah.
And why was there no storage? Because I guess that's where
Yeah.
our problems start.
Yeah. Yeah.
And number two is also understand the food chain. Man is the only animal, in terms of biologically speaking, that doesn't have a natural predator. So the herbivores will eat grass, the cannibals will eat the
Yeah.
the herbivores, and even the lion will eat meat
Yeah.
and leave some for the greedy hyena.
Yes,
The hyena
yes.
will leave, and etc. etc.
Yeah.
I think we should also be
All right.
cognizant of what portions we take,
Yeah.
and also where we can share. It's better to share so that you don't have one hungry, and the other one having
extreme-
metabolic
Yeah,
issues.
yeah.
It only happens in human beings.
Yeah.
And the buffaloes are thin, they are all thin. When they are fat, they are all fat. So the lions and the other carnivores.
Yeah.
So the portions and how we eat and how we share and why we store, we need to ask ourselves those
Yeah.
questions. And
Yeah.
then physical activity is very important. I think we were bone gatherers and hunters in the initial days. Therefore, we stopped doing that. You can hunt and gather from your seats there.
Yeah.
So you have to remember then to do physical activity for the day.
Yeah.
And then regular medical checkup.
Yeah.
And not to be afraid to have medical checkup, not to be afraid to see doctors, and not be afraid to go to hospital.
Yeah.
We are living in an information world where all this information are available, but you must act eventually and
Yeah.
see a doctor who will then direct you.
Yeah.
It's been a pleasure to be here. I'm glad I came.
Yeah.
And I just say God bless to the
Amen.
audience. Yeah.
Amen.
Yeah.
And it was a pleasure to have you, Dr. Essen Oberu. Thank you so very much. And we are blessed. And I believe we have been challenged, and we will pick up the challenge, and we will become better men. And so thank you so very much. And even for the amazing work that you are doing, may God continue to bless you
Amen.
as well.
Amen.
Amen.
Thank you.
Thank you so much
Thank you
also.
for the invitation.
And thank you for joining us this evening. It's been real. This has been Men on Record. A repeat of the same tomorrow, 6 p.m. on Hope TV. Share the link with everyone and make sure that you are sharing with a man so that I can also be able to tap into that knowledge that Daktari has shared with us this evening. From the entire crew that has made today's production a success, I've been your host. My name is George Gishoro. This has been Men on Record, because it is a man's thing. Good night.